There it is.
Good evening, everyone. Glad you can make it on a soon to return to winter night. It's going to be cold tomorrow, the next few days. We have a bunch of people still signing in, so we'll give them a few more minutes to make sure everybody has a chance to participate. I'm Dr. Mike-Pownall. I'm one of the partners at McKee-Pownall Equine Services, and looking forward to episode 3 of our 5 webinars with Dr. Rafa Gomez from our Caledon location, talking this evening on breeding your mare. So Rafa, why don't you put yourself back on screen, and we'll give everybody another minute, and then we can start up. We are recording this, so if there's anything that you're like, oh geez, what did he say? We'll be able to post it online. And if you have questions as you're going along, you can see the box at the bottom of your screen that says Q&A. Just click on that, type in your question. If there's something that's very time sensitive, I'll interrupt Rafa as he's talking. Otherwise, we can have questions at the end. But it's a small group tonight. Let's keep it very informal. So Rafa, why don't you share your screen, and over to you.
Thank you very much, Mike, and thank you everyone for joining us again on another episode of our winter series. Today, I thought we can talk a little bit about breeding the mare and the different options that we have to breed our mares. As we know, we have several options, but a lot of times we don't know what any of the options mean, and everything that involves those different options. So first of all, I'd like to start with a reminder, like we always do, just reminding us about how our mares behave reproductively. They are seasonal. They only have estrus behavior in long days. They are polyestrus, meaning that they have several estrus during this season. They are considered monoovulatory, meaning that they can only ovulate one follicle and one oocyte, but we know that there's these percentages of mares that have double ovulations, meaning that they could have twins, and we know that that's not the best thing. They reach puberty in between 12 to 18 months, but we talked about a little bit in the first webinar that it's not the same as sexual maturity, where I like to consider it around 3 years old to 4 years old. The estrus cycle length is 21 days plus minus 1.4 days, and the estrus, when they're in heat, it goes from 5 to 7 days. And today we're going to focus on that part, specifically on the estrus part, because that's when we're going to breed our mares. So this is another reminder of the estrus cycle of the mare. So we know that there's the estrus or the heat behavior that it will end 24 to 48 hours after there has been an ovulation. And then we go to a period of diestrus when the uterus prepares itself to receive a pregnancy. Here we have the progesterone as our leading hormone. Here we're gonna have estradiol, LH, FSH. Here we have a little bit of inhibin. But then we're gonna focus on the estrus. So as I said before, it lasts from 5 to 7 days in most mares. That's the average. Ovulation occurs 24 to 48 hours before the estrus ends. We're going to have the presence of a pre-ovulatory follicle. That is going to give us the oocyte that is going to be fertilized by the sperm. And there's going to be changes in the anatomic portion of the mare, in the uterine and the cervix specifically. The uterine is going to get edema. And we like to see that edema because that means that uterus is responding to estrogens, and we like estrogens to be there. And the cervix is going to be relaxed. Basically, it's a door that is going to be open for the sperm to go by, and it can reach fertilization. So another reminder on the anatomy of the mare, and this is going to be important because when we talk a little bit about insemination and the insemination process, we'll talk a little bit about where we deposit the semen when we're doing it. So from the outside to the inside, we're gonna have, well, we have the vulvar lips, we have the vestibulum, then we're gonna have the vagina, we're gonna have the cervix, then we have our uterus. Our uterus it's bicornuate, or it has two horns. At the end of each horn, we're gonna have the oviducts, and after that, we're gonna have our ovaries, where our follicles and cells are going to be housed. Important thing, there are two insemination processes that we're gonna be. One's gonna be transcervical, so we're gonna pass the pipette and we're gonna deposit the semen just passing the cervix in the uterine body. And when it comes to frozen semen, it's gonna be a deep horn, meaning that we are going to aim that pipette and we're going to deposit the semen here, like right in the entrance to the oviduct where fertilization takes place. So now, what options do we have to breed our mares? Well, we have some options, right? We have the natural cover, the way it happens in the nature. It could be in the pasture, just like they would do when they're wild, or in-hand natural cover. We have artificial insemination with fresh semen or with cooled semen. I put them together because the technique and the process, well, the protocol is usually the same. We have artificial insemination with frozen semen, and we're going to talk a little bit about these new technologies that are becoming a little bit more famous and a little bit more approachable, especially in the US. We don't do it that much, but that's the OPU and ICSI, that it's ovum pickup and intracytoplasmatic sperm injection. We'll talk a little bit about at the end. So the first option that we have, it's gonna be the pasture breeding. So it's basically what horses do in the wild. What are some of the advantages that I see in this type of breeding plan? You don't have to handle your horses that much because they're free. They're doing their own thing. The expenses are going to be low because you don't need the personnel to be handling the horses, and they don't have that risk to the personnel. And the breeding expenses are going to be low too. What are the disadvantages? We can have several injuries to the stallion or to the mare. If we don't have an experienced stallion, the mares are going to beat him up. And I mean, I've seen that happen, and it's shocking because you may think that a mare is in heat, but there are some mares that are dominant, and they like a dominant stallion. So if the horse has never been in this type of breeding situation, sometimes they don't have the experience and they can get beat up by the mares. And if they don't have the experience to how to approach a mare and tease a mare before mounting them, they can have pretty bad injuries. There's an inability to detect reproductive problems. We can't know if a mare has post-mating induced endometritis. We can't know if there's an infection. If we can't know if the stallion is transmitting the infection, or if a mare transmitted it to the stallion, or what happened. So there's going to be a spread of different diseases, and that's never good. And we won't be able to calculate our foaling dates for the mares, and this is very important, especially when the mares are going to fall out, and we like to be prepared. I mean, if it's a mare that is just going to be in the pasture and you're not going to check her, and it's just everything's going to happen like it would do in the wild, well, that will happen. But I think our horses and the horses that we're breeding now, they have a greater value, and we would like to have that foal to be born in the best conditions possible. So the other option that we have is in-hand breeding, and this is very common, especially in thoroughbred farms. They're not allowed to any other type of breeding, so it's pretty common. So advantages: you can schedule the breeding, and you can confirm that the mare has been bred. The mare can be examined before and after breeding, so we will have control if that mare is having post-mating induced endometritis, or if she's having an infection, if she has fluid. So we're gonna have control of that. We can even get a dismount sample of the ejaculate to search for live spermatozoids. And theoretically, there's less risk to the stallion. And this is when the in-hand breeding is made with the proper security measures for the personnel, for the mare, and for the stallion. And it's theoretically because we know horses are strong, and they can, in 1 second, there can be an accident. Disadvantages: the time required for satisfactory examination. And for teasing the mares, it's very important that if you're going to do natural cover, to tease a mare, because that will show you if that mare is really in heat, or if she's reluctant. You will know, and you'll have more tools to protect your stallion. Another disadvantage might be the number of personnel required for these. I mean, if the mare is really quiet, and you know the mare, and she's very receptive, and you know the stallion, it can be done maybe with 2 people, but I always like to have more people there, like 3. It usually requires 3 or 4 people to be involved. And the risk of injury to the personnel and the horses, that is always going to be there. So it might be a little bit cheaper than insemination, but also you are using your stallion, and it's not as efficient. It's not as efficient as it would be like in an insemination program. Why? Because he's ejaculating his whole spermatozoids in one mare, and usually with one ejaculate, depending on the stallion, you can have the dose to breed 3 to 4, even 5 mares. So this is natural cover as some of the in-hand breeding. Here I have some examples of how you can protect your mares and protect your stallions. What is very important is we need to have restraint of the mare, good restraint, usually a chain over the nose, or even a lip chain. Hobbles, I would always consider using hobbles. I mean, this is very important to protect our stallions. Some mares don't like it. You have to get them used to wearing them, but they are fundamental. Tail wrap. A lot of times I've seen that this is forgotten, but it's very important to have a tail wrap also to protect the penis of the horse. I like to use a twitch like we have in this example, but in this example we didn't have the hobbles, and this was just because we knew the mare, we knew that she was very receptive, and we knew the stallion. So what are we going to do when we're breeding in hand? We're just basically detecting estrus. There are 2 things that we can do, or that your vet can do. You can do it the old way, that is every other day breed the mare when she's receptive to the stallion. We know that semen is it lives for 48 hours inside of the mare's uterus. So what everyone does is every other day until the mare is not receptive to the stallion, and that's okay. But I would consider it's better if you have a thoroughbred facility, or you have several mares, to have your vet check your mare, and to make things more efficient. And this would be just detecting the estrus of the mare. If you have a teasing stallion, okay, you have a mare in estrus, have the vet check her, check that she's clean, check that she has a big follicles, like over 35 millimeters, and then you can induce ovulation on those mares. And with this, you can breed the mare 24 hours post induction of ovulation. and then the mare will ovulate in the next 12 to 18 hours. So that way you're being more efficient in breeding with the stallion. You just want that stallion to mount a mare once and not waste himself in mounting that mare several times when he has a bunch of other mares ready to be bred. So that's usually how it works. What we do more, and what we've been doing more in the practice, it's insemination. It's usually with fresh or cooled semen. More so with cooled semen, where we have that semen that is being shipped from the other side of the country or from the US or whatever. So for this type of breeding, there are several advantages that we have. We have an evaluation of the stallion semen prior breeding, so we know the count of the spermatozoids that stallion is ejaculating. We know the morphology. We know how they're moving, if they have like progressive movement or if they don't. And basically we can share those that ejaculated, we can share those doses into different mares and be more efficient in breeding them. It will ensure that we have motile spermatozoids, and this is very important because you can have an ejaculate and you can have spermatozoids moving, but we want spermatozoids that are progressively moving. And what does this mean? This means that it's a spermatozoid that is going to go forward. It's going to swim forward, and it's not going to be just moving in circles, because those are never going to get a mare pregnant. They're not going to reach the oocyte. We need those spermatozoids that are moving forward, and we can see that every time we collect a horse. We're going to evaluate them, and we're going to see all the characteristics of the semen. So that's a great advantage of these. There are minimal contamination techniques during breeding. So when we're collecting, we have to clean the penis real well. We use sterile liners, we use sterile filters, and everything is so clean, trying to diminish or to eliminate the risk of sharing diseases. And also the risk of getting a mare's uterus infected. Also, when we are inseminating, we are placing a tail wrap. We are preparing the perineal region. We have to clean it real well. We're using sterile gloves, sterile lube, sterile pipette to go in. So there's minimal contamination. And as I said, we reduce the disease of transmission. Also, one thing that is important, we're going to reduce shipping costs. If you don't have to ship a mare to where the stallion is, that's going to reduce those costs. Also, every time you're shipping a horse, there's a risk for that horse, specifically in this case for the mares. So that's very important. So some generalities about breeding with fresh and cooled semen. The minimal insemination dose, or the minimal breeding dose, is 500 million progressive motile spermatozoids, meaning that only with 500 million spermatozoids that are moving forward, we can breed a mare. For cooled semen, the recommended dose is just 1 billion. So we doubled that dose, and it's what commercially it's been used. Why? Because we want to make sure that mare gets pregnant, especially if we're commercializing the semen of that mare. The motility for breeding with cooled semen, it has to be more than 50%. I think that's adequate. And usually when we cool that semen, and cooled meaning that we're going to have it in a temperature between 4 degrees to maybe 6 degrees Celsius, it's going to be viable for 24 to even 48 hours post collection. And also that semen is going to be viable inside the mare 24 to 48 hours post insemination. So it's a pretty good semen to use, and it's a pretty good method, especially with semen coming from the US. We can get worried if, like, we are collecting a stallion on a Tuesday, but the semen is going to get here on a Wednesday. how do we make that work? So we know that that semen is going to be live, that is going to be viable, that is going to be adequate for that mare, as long as it comes with a good motility. Important for this, we need to have a protocol, and we need to be involved following that mare cycle, and then being very keen on the ovulation induction agents. We usually use HCG or deslorelin. I'm pretty sure that you guys have heard of them. And basically what these agents do is they act like LH. If we go back to our estrocycle talk that we had, they act like LH, and they promote ovulation, and they're gonna make that mare ovulate in between 36 to 40 hours post administration. So we know that that mare is going to ovulate in that period of time, so we can play in the estrocycle, and we can play with the timing of when we are going to inseminate them. This is a sample from a stallion. This is a cool semen. This was refrigerated. Well, I think it was showing before, but there it is. We can see like how the spermatozoids are moving, how in this field, subjectively, you can see like more than 70% of those spermatozoids are moving. I would say like 80. Obviously, in this video, we cannot see like perfectly the ones that are progressively motile, but when we're watching them in the microscope, it's easier to see them. So what would be a good protocol for our mares? The start for these mares, I would consider doing a breeding soundness exam. We need to know that our mare has a clean uterus, that her cervix is functional, that her vulvar lips are functional, that her ovaries are working, that are having development, the follicular development. Then we have to detect the estrus. And for this, same, we have to follow it with ultrasound. Once we know, or teasing the mare, once we know our mare is in heat and she has a follicle greater than 35 millimeters, and this is very important, she needs to have uterine edema grade 2 or 3, meaning that there's estrogens there reaching that uterus. We're going to induce ovulation. Once we induce ovulation, we know we have 36 to 40 hours before that mare ovulates. In an ideal world, we're gonna want to inseminate that mare with cool semen or with fresh semen 24 hours post the induction of the ovulation agent. So say if we're breeding a mare, we detect that she has a follicle greater than 35 millimeters today, Monday. We induce ovulation today, Monday at, I don't know, 10 a.m. in the morning. We're gonna aim to be breeding her. Obviously, if we have the availability of the semen, we're gonna think about breeding her tomorrow, Tuesday, 24 hours post the induction of this agent, and hoping that she's going to, well, knowing that she's going to ovulate 12 to 18 hours after we inseminated that mare, meaning that there's going to be live spermatozoids there waiting for the oocytes. As I was telling you at the beginning of the talk, we're going to do this insemination. It's pretty easy, and it's just transcervical artificial insemination, meaning that we're depositing the semen just passing the cervix in the uterine body. There's no need for us to go any further, but we have to go there. The next thing that we're gonna talk a little bit, it's about frozen semen, and this changes a little bit because frozen semen, it's more sensible, and it's and we have to be more time sensitive when we're breeding these mares. So one of the advantages that, well, some of the advantages that we have with frozen semen is the commercialization of the semen, that this can be worldwide, right? We are storing semen at temperatures of minus 196 degrees Celsius. And so we can move those tanks from one part of the world to another. it's not time sensitive because they can be preserved there for years and years and years. Unlike the cooled or fresh semen that we have 24 to 48 hours before the sperm start going at degeneration and they start dying. So we're gonna have reduced Mare shipping cost, same as the other one, but it's also going to help us to preserve high value genetics. And this is very important with high value horses. We can breed a mare with a horse that died several years ago now, just because we have frozen semen, and that makes frozen semen a valuable tool if you have a high value stallion. I will always recommend, if you have a good stallion, to collect semen and to have some doses for you, just to keep them, to storage them if you don't want to commercialize them. And if you want to commercialize them, it's always good to have them in hand because you can send them to whatever you want. Same as with fresh and cooled semen, reduce disease transmission, minimal contamination. And in this case, we're going to do a really low volume artificial insemination. So in some generalities about frozen, we're going to have a breeding dose of 250 million progressive motile spermatozoids. So you notice that it's half, but it's because we're helping the semen get closer to where it has to be. The motility, if it's greater than 30% post-thawing, it's a good quality frozen semen. You want it to be more than 30%. And that's why in this video, you might think, well, this looks really, really different than the other video. But if you consider that it's post-thawing, we don't have a great progressive motility, that's true, but most of the spermatozoids, I mean, at least 30%, maybe 30, maybe 25%, it depends on the eye, it's moving. So it doesn't look great like the other one, where everyone is just like moving. But if we're considering that it's frozen semen, that it had gone through all that process and being stored at that temperatures and then coming back, more than 30% motility, it's really good. Another difference that is important, it's just going to be viable for 8 hours post-insemination. Contrary of cooled semen that it's 24 to even 48 hours, this is just going to be alive for 8 hours inside the mare's uterus. And this is important to know because we also have the other part, the oocyte. Once a mare has ovulated, that oocyte is viable for 6 hours post-ovulation. And this is a topic of discussion because there's literature that said it could be viable up to 12 hours, and some literature that says that even more of that. But I like to consider it 6 hours. I don't like to play with frozen semen. I don't like to play my odds. If I don't know that mare has ovulated before 6 hours, I won't even consider breeding her. If I don't know that it's been less than 6 hours, I don't consider breeding her because I know how expensive frozen semen is and how valuable it is, and I wouldn't dare to just test it and wing a dose and just say like, hey, well, we're gonna see if this works. And for this technique, we're gonna do a deep horn insemination, as I was saying before. We're gonna deposit this semen right next to the oviduct at the very end of the uterine horn. And this is why we're gonna use very low volumes. We're talking that frozen semen, it's usually stored in straws of 0.5 ml. Each straw, depending on who is doing the technique, but each straw may have from 100, 150 to 100 million spermatozoids. So we usually use double of what the dose of the breeding dose is. So we're usually using at least 4 straws, meaning that it's 2 ml, or even 8 straws, 4 ml. So that's important to know. The protocol, it's going to be a little similar at the beginning. breeding soundness exam. That's always really, really important to know how your mare is. Detect the estrus, same. We're gonna check the mare. We're gonna find when she has a follicle greater than 35 millimeters, good uterine edema, greater than 2 and 3. And we're going to induce ovulation. The only difference now is that we need to be completely sure when that mare has ovulated. And for this, we're going to check for ovulation after we induce ovulation every 4 to 6 hours. So it's a bit of a tough process. I mean, it's some work, but we'd rather do this than coming back and checking a mare in 36 hours and finding out that she had ovulated and not knowing if she ovulated an hour ago or 8 hours or 10 hours ago. So when we induce ovulation, it's important to say that there are some mares, like for everything, mares, they don't read books. So there are some mares that they don't go to those 36 to 40 hours post induction of ovulation. I've had mares that they ovulate at 24 hours. There are mares that can ovulate even before that, or mares that just won't listen to your ovulation agent and they just keep going, and in 48 hours, you're still checking the mare. The important thing in these protocols is that we have to make sure that she ovulated within 6 hours of you checking her. That's why we are checking them like that. And so we end up checking them overnight. And of course, if they listen to the induction ovulation agent, they're gonna ovulate. We're gonna check for ovulation, and once that mare is ovulated, we're going to inseminate. That's another difference from the other protocols where we inseminate and then wait for the mare to ovulate by herself or via the induction agent, the desloratadine or the HCG. We wait for it because we know that there's going to be viable semen there, because we know that semen is going to last for 24 to 48 hours. But in this case, with the frozen semen, it only lasts 8 hours. So we have to make sure that there is viable semen and that there is an oocyte there. That's why we do it, and I like to do it post-ovulation. There are some other protocols where you can do it before and after, dividing a dose. But in the literature and the Congress that I've been, like almost all the vets, we like to do it post-ovulation and putting the entire dose, because we know there is going to be an oocyte, and we know that there's going to be spermatozoids there that are going to reach, and they're going to meet, and they're going to be a fertilization process. So those are basically like the main differences on how we can breed our mares. The doses and how many straws we use per mare are going to depend on the stallion. And this is another thing that in repro is, it likes to keep us on our toes, and then sometimes it's frustrating because everything depends. It depends on your mare, it depends on the stallion, on how well it freezes or how well it thaws. So it depends. I mean, the doses depend, and usually whoever is commercializing the semen will let you know how many straws you have to use based on that stallion and the dose in which they load the straws. It's important to know that for frozen semen, our pregnancy rates are going to be around 50 to 60%. So they're low, but we're talking about high valuable mares and stallions. So I think it's worth it. It's really important to have your mares checked before and to have them have a good breeding soundness exam, because you don't want to inseminate a mare that has an infection and waste a dose of frozen semen. And now, so for some of the newer technologies that we have, this is the OPU-ICSI. So as I said before, OPU stands for ovum pickup. ICSI is intracytoplasmatic sperm injection. So this is basically how it goes. The process starts with the mares. We're gonna do the ovum first, ovum pickup. So what we're doing is we're extracting follicles, small follicles. We are getting all those oocytes from the ovaries. So we get immature oocytes, but we get a bunch of them. So we're flushing those ovaries, we get those oocytes, and then we have them, we start a maturation process in the lab. Once those oocytes are mature enough, we're going to do a single sperm injection into the cytoplasm of that oocyte. There is no in vitro fertilization in the mares yet. There's been studies, but they have never been successful. So they came up with this, and this actually came from human medicine, where they actually inject one spermatozoid into the cytoplasm of that oocyte, just to create a manual fertilization. Foaling rates are up to 50% based on an article released on 2020. In show mares in Europe, it has been up to 50% rate of foaling. So it is a good technology, especially it has been done post-mortem on mares and also on all older mares, or mares that you want to have more more offsprings, more foals than just one per year, or maybe 2 or 3 with embryo transfers. You can always have the do the ICSI, and once the embryo is blastocyst, you can vitrify it, that is basically freeze it and storage it, and then wait for whenever you want to use it. So this is one of the new techniques that it's out there. It's not as commercial yet. They're doing it, I think they're starting to do it a lot more in the US, but as I said, with very specific mares and specific stallion. This also brings, like, this is very exciting because also brings like a great advance for stallions that their frozen semen wasn't really good, because you only need one sperm here. So with one straw, you can just cut that straw and get like a tiny dose and pick the best spermatozoid and just inject that one. And that has been showing like pretty good results with horses that were subfertile, or that they didn't have the best fertility in when having frozen semen, or even in fresh semen, but they have been using it more with frozen. So basically that's those are the options that we have. So the take-home message would be that we know there's many options, but now we know what are the options that we have, and it's important that you choose the best option for you and for your mare, and know the advantages and disadvantages of each option, and what the process will look what the process will look through, how the process is. You know now how the process is. Like if you're going to inseminate a mare with just with cool semen, you know that we have to check them, but we can inseminate and we can wait for her to ovulate. Or if we're going to do a frozen mare, now you know that we have to check her like every 4 to 6 hours just to confirm ovulation. It's the best thing you can do is choose what's best for you and for your mare. Know the benefits of each technique, because even with the pasture breeding, you can have some benefits. Familiarize yourself with the process. We have the information now. You know, and with the webinars that we've been doing, now you know like the estrous cycle, more or less how it behaves, and how to expect in your mare cycle, and where you're going to inseminate or breed her, and what are the problems that you may find if the mare is not getting pregnant. And now you know which option would be the best for you. Have realistic expectations. Don't be expecting a 90% pregnancy rate if you're doing all frozen. Always investigate the stallions, talk to the stallion owners, talk to them, ask them about their pregnancy rates on the stallions, how the frozen mares that they have inseminated before have worked, if it had worked well, the doses. This is very important to investigate before you choose your stallion. And it's very important to follow the process, and for these to have records. The records of your mare are very important, and it's very important to follow this process and go along your vet. Us as veterinarians, there's nothing that I love more than having a client that is like, hey, my mare is in heat, or I saw this, or does she have fluid? How was her follicle? Did she ovulated? Does she had a good CL? How was the tone on the uterus? I love clients asking me all the questions because I can let them know. Sometimes when you have a reproductive appointment, the only thing that you see is that the vet goes in, we do the rectal, we feel everything, then we do the ultrasound, and we tell you, okay, she has follicle or no, or she has edema. But when people start asking me questions, I can tell them, no, you know what? The cervix was open, was a little bit, or it wasn't that open. It's a little tight. We have to have an open mind about the cervix, or let's do a vaginoscopy, or everything. It's very important to follow all the process. So with that, thank you very much for staying for the talk. I hope you liked it, and we're open for questions. If you guys have some questions, I'm happy to answer them.
Yeah, you can ask, is Mike here? You can ask your questions either in the chat, or if you want to unmute yourself and just ask them directly. Also remember, this will be recorded and we will post this. So if you want to come back to anything, we can do that for sure.
Yep, for sure. If you guys have any questions, feel free to send them to any of our social media web pages too. We're doing the Theory of Thursdays, where we're just releasing some fun facts about the mares and the equine reproduction. So we're happy to answer questions if you have any there.
Yeah, every Thursday we have them on Instagram and TikTok, and we have found out that Dr. Gomez is a very good artist too.
I try my best.
I was looking at the one last week and I was like, I just learned something. This is actually very good. All right. I haven't done repro in so long that I didn't know it. I forgot I knew it, but now I know it again. So
I'm glad. That's the whole point. Just to make them like fun.
Yeah, fun and approachable, and everybody spends so much time and energy breeding their mares, so make it easier, even better.
Yeah, that's the plan.
Oh. Any last call for questions? Do you remember, Rafa, when your next session is? It is in
it's February 21st. February, I think it's the 21st. We have the next one. The next talk, it's about embryo transfers. So we're going to talk a little bit about the history and how to select a donor mare, how to select the recipient mare, and a brief summary on how the whole process of embryo transfer goes. So it's going to be an exciting one. That one's going to be fun. And the last one, last but not least, is the foaling, and some tips about foaling your mares. That one is going to be fun. We all love the babies, but it's good to be prepared for when you have a mare.
Boy, spend so much time. Rafa, we have a question, and the question is it healthy to breed a mare each year, or should you give them a year off?
That's a very good question, and and as all of this, it's going to depend on the mare, on how she is behaving year after year. Of course, we want to see mares get pregnant year after year, but here are several factors. We're going to have age of the mare. How old is she? 2, how the parturitions have gone. If she had any bad parturitions, dystocias, or cervical tears, or if she had problems during that parturition. 2, how healthy the foals have been. And then we need to know how the mare is at the beginning of the season, of the reproductive season, or once she falls out, their body condition, especially if it's a mare that just falls out, she's going to be lactating and we're asking her to be pregnant. So we have to have them in a very good nutritional state. And then the reproductive soundness exam. We need to make sure that that mare, it's clean, that she doesn't have any infection, that the uterus is not pendulous. Like some of the older mares like to all the ligaments that are holding the uterus in place, they relax a little bit during the years and the pregnancies. So we need to make sure that the uterus is not that pendulous and that those ligaments are okay. So it depends on each mare. You can do it for sure, but there's gonna be one season that she's going to need a break. I cannot tell you if it's going to be after one fall or if it's going to be after 5 falls, because we have mares that they just keep falling year after year, and that's what we want in every breeding facility and breeding program. But there's going to be mares that at some point are going to be like, okay, I just need a break, and they will let you know. They will start just having problems catching, or they won't come into heat. They won't be cycling really good. So they'll let you know.
Excellent. Okay, last call for questions. Otherwise, you must have just explained it all so well. So thank you, everybody.
Sure.
And we'll see you on, you said it was February 21st?
Yeah, I think it's the 21st.
Okay.
But just check the social media pages, and you'll find all the information there.
Okay. Thanks, everyone.
Cool. Thank you, everyone.